The PEITC in cruciferous vegetables have been shown to inhibit breast cancer, and new mechanisms and blood markers have been discovered recently. Hi, I'm Dr. James Meschino. You know, there are many anti-cancer compounds in cruciferous vegetables. We've known that for a long time. Cruciferous vegetables are, broccoli, Brussels sprouts, cabbage, cauliflower, bok choy, turnips. But there's a molecule in there called the PEITC, which is a compound derived from cruciferous vegetables, which shows very impressive anti-cancer properties. So in a 2012 breast cancer study using a mouse model, where they sort of give mice breast cancer intentionally, the mice that were given the PEITC administration had more than a 50% reduction in breast tumors that were sort of smaller than 2 millimeters in size. And you also saw that the tumor cells in those mice that got the PEITC had a slower rate of cell division of the tumor cells, and they also were less able to make blood vessels to feed themselves. And this is how cancer usually develops, is that the tumors are dividing, then they secrete chemicals to give them more blood vessels. That brings them more nutrients so more cells can keep dividing. So it was shutting down that process as well, and encouraging some of the tumor cells that were in there to actually commit suicide, a program that's known as apoptosis. So this has important applications for human breast cancer prevention, we think, because these are similar mechanisms. What's happening in the mouse model of breast cancer is very similar to what happens in breast cancer development in humans. Now, in the study, they also discovered a new blood marker. And the blood marker, if the blood marker was rising, then the tumor mass was growing. If the blood marker was going down, then the tumors were shrinking, or the tumor mass was not increasing. And so the thinking is that this new blood marker may one day replace mammograms for early detection. You see, the problem with mammograms, some argue that mammograms produce radiation, which may itself cause genetic damage to breast cells and maybe is contributing to some of the breast cancer that we see. So there's a lot of debate about this. So it'd be very nice to find a non-invasive early detection tool that didn't cause damage. And so this new blood marker may be just the thing they're looking for. So to really understand this, click on the link below and read my review article on this. It's short and sweet and right to the point, but it contains all the details, including my own personal dietary and supplementation recommendations that I think you should follow on this subject. Now, MeschinoHealth.com, you'll see my other research review papers. You'll see footage from my live professional seminars, other downloads and resources and videos I've created. They're all there to help you lead a long, healthy, functional life. All my teaching materials and research review papers have all the scientific references in them, so you'll see you're only getting evidence-based information from me on any health topic that you're looking for. So you should use MeschinoHealth.com as an ongoing, reliable resource of health and wellness information for both you and your family. Thanks so much for watching.